I'm here to talk about some of the privacy implications of some of the measures, the key measures that businesses will need and want to take as the lockdown lifts and they try to get their employees back to work safely. So some of the measures that might want to be taken, including things like temperature testing, thermal imaging cameras, testing employees, as Alex mentioned, will have implications from a privacy perspective because they involve the use of personal data. So that's data relating to employees and other individuals. And these, the processing of personal data is governed by data protection laws. Data protection laws, as you might imagine, are not there to create a barrier between you taking measures that you need to take in order to get people back to work safely as the lockdown lifts, but they do require you to ensure that the use of personal data is necessary and proportionate and that it's fair, lawful and fully transparent. We know that a lot of businesses have already implemented their own track and trace apps, or if they haven't, they're seriously considering doing so. And these are on the market, often as part of a wider solution to combat the spread of the virus within the workforce and deal with the risks as people get back to work. Now, obviously there are privacy issues when rolling out these apps because you are essentially monitoring employees' movements and also collecting health data if they report that they've been tested positive for the virus or been in contact with somebody who has. The NHS app has been designed very much with privacy in mind, as you might imagine. So, for example, it strictly limits the scope of personal data that's collected, data that actually identifies individuals, because it uses anonymous Bluetooth identifiers to match the devices as opposed to using GPS, for example, which would track location data, which is much more intrusive. It also strictly limits the data that's kept stored centrally. So instead, a lot of the data is stored on the device itself, which is less privacy intrusive. And of course, access is primarily restricted to the NHS, which is a public health authority, has a very strong legitimate need to get that information in order to fight the pandemic. So as a business, if you roll out one of these apps to your employees, you need to ensure that it complies with data protection laws. You as the controller, as opposed to the app developer or provider, will have the obligations under data protection laws to make sure that it's fair, that it's lawful, and that it's transparent. And so you need to do some due diligence before rolling out one of these. So you need to speak with the app developer or whoever is providing it to you, see their data protection impact assessment, make sure that it complies with data protection laws, make sure that there is full transparency to employees about how their data will be used as a result of it. It's a matter of identifying where you're going to be using personal data as part of these measures, and just taking some key compliance measures to make sure that the right balance is struck between the health and safety obligations and respect to the right of privacy.